Okay. So, hindi ako kabaluhan. So, chill lang ka muna, guys. And I think you have enough notes. And kung may ara pa nga inugdugang na notes, so take down na lang. Sino to? Okay. Okay, so the topic is antimicrobial susceptibility test. The second to the last topic that we have for ano yung ganyan? Clinical Bacteriology Laboratory. Okay. Yes, Miss Billy. Belly Sena. May concern?
Sorry, ma'am, napindot.
Ay, hindi na yan. Hindi ka mapatawad. Oh, sorry. Char. Okay. Sige Ma-start na kita. Antimicrobial susceptibility test. This module is prepared by Ana Maria Diana Sobrino Salazar. So, Italian ang name. Okay. So, what we need to have after this topic is we need to identify correctly the importance of antimicrobial susceptibility testing. Number two, define comprehensively terms used in antimicrobial susceptibility testing. Identify correctly the mode of activity. Give examples and describe the spectrum for major antibiotic classes and its class. Okay, so your antimicrobial and antibiotics have the same meaning. So these two different words have the same meaning. So in this PowerPoint or in this lesson, these words will be used interchangeably. Okay. So antimicrobial is the same with antibiotics. And susceptible is the same with the word sensitive. Okay, so mo lang mana siya. Number four, identify and discuss correctly the different methods of antimicrobial susceptibility testing and its principle, factors that affect antimicrobial susceptibility testing, and understand comprehensively the principle, purpose, procedure, limitations of this diffusion susceptibility method, eventually perform correctly the procedure if we can do that practically. Okay. So, overview of our antimicrobial susceptibility testing. Once the causative agent has been properly isolated and identified, if you could still remember, no, different our previous lessons that we have, batian niyo ko? Okay.
Yes, ma'am.
Yes, ma'am.
Nami tingog ko. Wala gid may nag-yes, ma'am.
Yes, ma'am.
Yes,
Yes,
ma'am.
Yes, ma'am.
Yes, ma'am.
Ano to ba lang? Oh my God. Wala gid yung may nag-yes, ma'am. Do feeling ko doon na frustrate ako in a minute. Sure. Okay, so accept your flaws so that no one could use it against you, o diba? Okay, so once the causative agent has been properly isolated and identified, as what I have said, the different the previous lessons that we have is or are the methods of identification of our microorganisms. Diba, we have those non-enteric gastrointestinal pathogen methods. We have those non-fermentative. We have this gram-negative cocci, gram-positive bacilli, mga ganon-ganon. And Enterobacteriaceae, diba, we have the different methods on how we identify them. However, we don't have the steps on how to kill them or how to treat our patients that experiencing the infection of the microorganisms. So this is the next step. The next step is to determine the susceptibility and resistance of the organism to several antimicrobial agents or antibiotics to effectively treat the infection. Pinasaway na naman si ano. Hindi na to siya. Ay, hala, sorry good guys. Oh my God. Kinag-exit, sorry good. Advertisement. Okay. So testing methods include the broth microdilution or rapid and automated instrument methods that use commercially marketed materials and devices. Okay, this broth microdilution, broth di ba liquid siya. So this broth microdilution is being set up sa mga several tubes. Okay, several tubes with different dilution or concentration of the antibiotic and the inoculum. However, in rapid automated instruments, if you could still remember the word VITEC, the VITEK, VITEC, no? The VITEC is one of the machines which has the function to do the antimicrobial susceptibility testing of our microorganism. So this can be broth microdilution or rapid automated instruments. And then we have these manual methods. They provide flexibility and possibility of cost savings, which include the disk diffusion and the gradient diffusion methods. Okay, so when we say disk diffusion, we are using, ano no, daw, ang iyan na size, isang disk, okay, isang circle, is the same with the size ng punch bala nga papers ang gingamitan. Ang puncher na bala, di ba, may hole na, may circular na siya nga paper nga gina-discard ninyo, no? So that is the size of our antibiotic or antimicrobial disc. So that disc is being placed in an agar. So ang agar, ang solid agar is being placed sa plate. That is why ginatawag siya nga disc diffusion and gradient diffusion methods because we are using the small disc which is a punch size na paper and then we are placing that to the solid agar. And then next is, each method has strengths and weaknesses. Daw pareho lang man na sa isang tao, hindi tanan perfect, may disadvantages, kag advantages man ang kada isa. Some methods provide quantitative results. When you say quantitative, we are talking about the specific numbers or concentration of antibiotics needed to treat the infection from the patient. So we use this minimum inhibitory concentration or may ara pagid na minimum bactericidal concentration. And all of them provide qualitative assessments using categories the susceptible, intermediate, and resistant. Okay, if you have encountered a table, no, first column of your table is the microorganisms or the name of bacteria. And then next we have this three rows, no, S, I, and R. So meaning of that S is susceptible or sensitive, and then I is intermediate, and then R is resistant. Meaning of susceptible or sensitive is that it means that certain antibiotics is effective against the infection. And then intermediate is ara lang siya sa tunga-tunga. However, resistant means that antimicrobial agent or antibiotics is not effective against the microorganism. So this test can guide the physician in drug choice and dosage for difficult to treat na infection. Kaka-stuck video, sorry good guys. Okay, so next is selection of antimicrobial agents. So we have a lot of questions to ask first before we use this antimicrobial agent. So these are the following. Number one, does the antimicrobial agent have strong lethal effects and activity against the microorganism? Okay, it's just that the lethal effect against the microorganism, but we are also considering the low toxicity toward the host. Because we have, if you could remember from your lectures, no, in your bacteriology, there are some antibiotics that are causing aplastic anemia or bone marrow toxicity, di ba? May mga loss of hearing, mga antibiotics. Ang mga side effects bala sa antibiotics. So we are we are considering that also. It's not just the pariyogan isang slogan ni Biogesic, no. It's not just the bisa pero may alaga. So alaga at galing ko, no. Alaga at galing. Oh. Sa Biogesic. Subong ko lang na-realize kung nga amo na ila slogan. Because, di ba, the Biogesic has the tendency nga paayuhon ang imo sakit sang ulo as well as pwede siya magamit sa mga bata, pwede man siya magamit sa mga nagabustong or lactating mom. Because there are some paracetamol or Tylenols that are being ginadispense siya sa mga drugstores. However, ang iyang toxicity level is not that not that enough to take good care of the patients for the long-term use. Okay, so number 3, is the agent list toxic toward the normal flora of the host? Okay, so we are also considering the normal flora, no? Because when we say normal flora, amo na siya mga normal na mga microorganisms sa ating lawas. They are occupying the receptor of our organs for that nga hindi siya ma-disturb ni pathogenic bacteria. However, kung ma-destroy ni drug si normal flora, sumahalin si normal flora or mapatay siya sa iyang pwesto, and then isla na siya ni pathogenic microorganism. That is why we need also to consider the normal flora sang host. Number 4 are the appropriate pharmacological properties or mode of activity of antibiotics effective against the microorganism. Number 5, what is the status of host immune system? The other medical conditions such as corticosteroids, prolonged antibiotic therapy, and chemotherapy. Number 6, what is the host organ function? Number 7, antimicrobial agent water soluble and can it be distributed readily in the blood? Number 8, is there any underlying medical disease to the host, including the circulatory problem? And can the medication reach the infected site? So, if you are familiar with the different packaging of our drugs, di ba? We are using the enteric coated nga mga drugs. Ang ara balang capsule nga mapilit-pilit ang iyang So, those drugs are enteric coated. So, enteric coated na siya because it is protected against the acidity sa imo laway. Dapat nga maka-reach na siya sa imo stomach. And that enteric coated is nga packaging is gakatunaw na siya lang sa imo stomach wherein dira lang dapat ang iyan na action. However, kung the coating is not that ang iba naman nga naka-coat is dapat maka-endure sang acidity sa stomach in order to reach the affected site or infected organ. So, man na siyang gina-consider. And number 9, what is the age of the patient? Because if you are observing, no, di ba, may mga drugs kita na syrup, may drugs man kita na introduce siya sa body natin through injection, may ara man kita na oral lang. So, ang mga syrup kalabanan sa mga bata na siya na sa mga bata na siya nga mga sa mga pediatric patients. However, kung ikaw nga tigulang ka na kag hindi ka man gyapon ka tulon sang bulong sa mga capsule or tablets, di ba? May ara na siya, no? Ambot kung may ari sa inyo section. May ari pa diri hindi pa katulon sa mga capsules or tablets. Yudi, kasagad. Okay. So, kabalo na kamutanan. May ara da nga duga-digwa-digwa pa. Kaya gina-imagine ang sabor sang bulong. Okay. So number 10, what is the site of infection? Can effective blood or tissue levels be achieved? What is the route of administration? That is what I'm telling you. Oral na siya, intravenous, subcutaneous, intradermal, intramuscular. So those are different routes of administration of drugs. And thus the antibiotic cross the placenta, which may be toxic to the fetus. That is why pregnant women, they are not advised to um, uh, to take antibiotics no during pregnancy because there are some antibiotics nga toxic sa ato na patient. Wait lang, may-ari ko na diri. Ang ano na bala ang erythromycin, no? So ginagamit na siya nga substitute kung si pasyente mo is allergic sa penicillin, so ginahatag si erythromycin. May ara man nga drugs nga kung kabusong ka, ginahatag sa imo ang iban nga drug because makaharm sa baby. So na siya. Number 14, does the antibiotic penetrate the blood-brain barrier system, which is necessary in CNS infections? So na siya. Like for example, CNS infections, mga meningitis nimo. So na siya. And then number 15 is surgical intervention part of the treatment such as drainage or debridement for anaerobic infections. And number 16, cost-effective treatment. And number 17 is the host allergic or hypersensitive to the agent. Okay. So we have these 4 types of antibiotics. Number 1 is the beta-lactam. 2, antibiotics that alter the bacterial cell membrane. 3, inhibit protein synthesis, and then number 4, sulfonamides, quinolones, and other antibiotics. So they are being categorized according to the target part of the bacteria, no? Or pwede man target process, like for example, itong protein synthesis. Okay, so let's go to your beta-lactam antibiotics. Contains beta-lactam ring, works by inhibition of cell wall synthesis by inhibition of enzymes needed for peptidoglycan formation. It is estimated that 10% of population is hypersensitive or allergic to penicillin. So anong ginahatag mo sa mga pasyente nga allergic sa penicillin? Mr. Carnaje. What antibiotic agent or antimicrobial agent is being given to the person who are allergic to penicillin? Mr. Carnaje?
Ma'am.
Anong ginahatag mo nga bulong?
Erythromycin.
Okay, erythromycin. So very good, that is erythromycin. Number 6, antibiotics that alter bacterial cell membranes. They bind to outer surface of your cell membrane and alter the phospholipids which damage and disrupt the cell membrane, causing increased permeability and leakage. Kung mag-amo na siya, it means that there will be easier penetration of the antimicrobial agent against the pathogenic microorganisms. Example is your bacitracin, polymyxin B and E. So your bacitracin or bacitracin, primarily gram-positive spectrum and too toxic for internal use. Okay, I'm going to find that bacitracin. Okay, and then next is your bacitracin is ang ano na gani polymyxin B and E or the colistin is against the gram-negative and used as topical agents in combination with other antibiotics to treat skin burns, and wound infections. Ano ning ano man? Okay. And the next is antibiotics that inhibit the protein synthesis. Protein subunits of prokaryotes are 50S and 30S, which form a 70S ribosome. On the other hand, eukaryotes have 60S and 40S subunits, forming an 80S ribosome. So this difference in subunits of ribosomes permits development of antibiotics that can be selectively toxic on prokaryotic cell, like for example is your aminoglycosides, tetracycline, macrolides, and linosomide, and chloramphenicol. Okay, your aminoglycoside is effective against the Pseudomonas aeruginosa, no? Aminoglycoside, like for example, is your streptomycin, gentamicin, tobramycin, amikacin, and ethylmycin. So this is effective against Pseudomonas aeruginosa and gram-positive and gram-negative microorganisms. They are ineffective against the anaerobes and as well as toxic to kidneys and ears. Okay, aminoglycosides. They are only used to treat serious gram-negative infections and often used with beta-lactam antibiotics. Okay. Makita niyo pa ang screen, guys?
Yes,
Yes, ma'am.
Okay, so next is they achieve more rapid killing by using this aminoglycoside na antibiotics. And then next for tetracyclines, they are effective against gram-positive and gram-negative, especially to the chlamydia and rickettsiae na mga genus. And then next is macrolides, linosamides, streptogramin group is effective against most gram-positive and some gram-negative, and erythromycin is being given to the patient who are allergic to penicillin. Next is your chloramphenicol. Okay. This chloramphenicol is not widely used because of toxicity to bone marrow, which that toxicity to bone marrow will be will be resulting to aplastic anemia. Okay, when you say aplastic anemia, there is absence of red cell or blood cell component production. Okay, when you say di ba, aplastic, no, aplastic. So wala na sang regeneration sang aton nga blood cell components kay aplastic anemia. So all of the blood cell components are being decreased during the aplastic anemia. So chloramphenicol is effective against a wide variety of gram-positive and gram-negative microorganisms. And then you add also fusidic acid. Okay, fusidic acid, FUSIDIC acid. Okay. So next, we have this. Naku guys, dali lang yun. Okay, ari na. Sulfonamides, quinolones, and other antibiotics, examples and mode of activity are sulfonamides, competitive inhibition of folic acid synthesis. Okay, so kung may inhibition of folic acid synthesis, it means affected si DNA nato, no? Okay, si DNA nga aman because one of Okay, so when there is inhibition of folic acid, the DNA activity is being affected. Kaiman, one of the function of the folic acid is to produce one of the building blocks of our DNA. So we have four, di ba, nga components ng DNA, the cytosine, guanine, uracil, adenine, and thymine. So if that's the case, nga si sulfonamide, gina-inhibit niya si folic acid, that will cause to megaloblastic anemia, no? Folic acid inhibition. So, sulfonamide. And then next, for quinolones, inhibition of DNA, gyrase activity naman, and interferes with DNA synthesis also. Letter C, nitrofurantoin, inhibition of bacterial enzymes or protein synthesis. Okay, another note kay nitrofurantoin, no? Si nitrofurantoin is a color yellow na siya nga disc because commonly your antibiotic disc is color white. Color white na sila nga daw papel lang gid na ang color urban paper. However, si nitrofurantoin color yellow na siya and especially impregnated siya sa agar nga may specimen nga ihi. Amo na siya si nitrofurantoin because commonly ginakure na siya sa mga urinary tract infection. And then next is si rifampin, inhibition of DNA-dependent RNA polymerase, and effective against the gram-positive and certain gram-negative microorganisms. Their resistance develops quickly and usually used with other antibiotics. So rifampin is against the Neisseria meningitidis nga mga infections and ginaduo na sila or synergistic ang ilang nga dapat ang way of giving, okay, sang drugs. So dapat gina-combo or ginaupod na siya sa iba na mga drugs. Okay. And then this rifampin also this rifampin is also causing a red-colored nga urine. Okay? Dayon ginahatag man ni siya sa mga patients who are suffering Mycobacterium tuberculosis infection or TB. Okay, si rifampin. So, ga-color red na ang imo nga ihi. Tandaan nyo, ang mga drugs that are given to the patient who are suffering tuberculosis infection, no, they are causing red-colored urine. And letter E, metronidazole reduction products cause altered DNA synthesis and resulting in bactericidal effect. And then this